I am happy to introduce Dr. Naomi Thulien. Dr. Thulien is a nurse practitioner and researcher committed to working with the community to tackle the social and structural inequities that cause and perpetuate youth homelessness. She is the co-founder of Breakwater Foundation, a nonprofit organization that provides rent subsidies, education bursaries, and primary health care to young women who have experienced homelessness. She practices clinically at the Breakwater Foundation Clinic and Covenant House, Toronto, Canada's largest agency for young people with current and past experiences of homelessness and sex trafficking. Dr. Thulien is also a scientist with the MAP Center for Urban Health Solutions, as well as an assistant professor at the University of Toronto Della Lana School of Public Health and an academic fellow with the University of Toronto Center for Critical Qualitative Health Research. So thank you so much, Naomi, for joining us today. I'm so excited for our conversation, and I will hand over the presentation to you.
Thanks, Priscilla, and good morning, everyone. I'm really honored to be asked to speak on this topic. My background, before I became a nurse practitioner, was in pediatric and neonatal ICU. I spent about 10 years doing that. So whenever I'm among colleagues that practice in this area, I kind of feel a little bit at home. And also, I just want to shout out to Priscilla. She is so organized, and everybody is so lucky to have her. I'm sure you all know that, but yeah, so it's just been a pleasure to work with her. And oh, thanks for the heart. And prepare this talk today. So I will share my screen. We will get going. Okay. There. Priscilla, can you see that okay? Yeah? Okay, great. Good. All right. Okay, so as Priscilla mentioned, I am a nurse practitioner at Covenant House, and really this is kind of where my journey began in the whole area of community-based research or community-engaged research. I really had no research experience when I first started working at Covenant House, and so I went back to school in 2012, a little bit later in life, because I wanted to learn how to do research in the area of youth homelessness. And so I guess I say that to say that all I've ever known is community engaged research, but that doesn't mean that I do it perfectly. I do it very imperfectly, but that is sort of where I'm coming from, and I can't really imagine doing research any other way. And so our learning objectives for today is I just kind of want to zoom out. I know sometimes if this is a little bit of a new area to you, sometimes you just sort of want the rules, but I find it super helpful to zoom out and say, okay, like what are we talking about when we talk about community engaged research? So we're going to talk about some definitions, some fundamental principles, and then I'm going to give you an overview of a guide that we've developed at Unity Health Toronto on the first level. And then I put little asterisks there because I really want us to discuss. I'm hoping I'm not going to talk too long, like no more than 20 minutes for sure, because I think we create meaning, right, when we talk about things. And so no question is too basic. In fact, I find that people that ask the most basic questions really understand this at a deep level because they can zoom out and go, but like fundamentally, what does this mean? So please, no question is too basic. And I'd love the opportunity to chat with you and to learn from you. Okay, so what do we mean when we say community-based research? So as I'm sure you guys have seen, it goes by a bunch of different names, but for the purpose of our talk today, I'm going to kind of zoom out and be like, just like fundamentally, what does it mean to do this work? So really, there's some key things, and this is from the Community-Based Research Canada website, and I've tried to give you links throughout, but this is a really great website. So the idea is that it involves active participation of the people that we're working with in all phases of the research. And we want to produce useful research, useful findings. And the idea is to promote change in the community. So again, active participation, all phases, useful findings to promote change. This is a book, and actually, I have it right here. I use it like I just use this all the time. It's a great book. If you don't have it, I highly recommend it. But they talk about like what does it mean to do this work. So the idea is that participants are experts in their own lives. I'm really interested in the notion of power, probably because I'm also a critical qualitative researcher. But they talk about power a lot. The importance of their communities' ways of thinking and knowing their knowledge is just as important as our knowledge. And the idea, again, is to produce some real actionable data that's super practical. And then the last one, and I'd love to talk more in the discussion about what this looks like. But really, the idea is that we remain invested with this community of people that we're working with beyond the life of a research project. So it's not a convenience partnership. It's like ideally a long-term relationship. Okay, so before I go any further, I want to talk about the elephant in the room because some of you may be thinking this already. This is super time consuming. And again, I would love to talk about this in the discussion and we'll maybe return to this. But these are a group of colleagues from Ireland and they call it public and patient involvement, so PPI. Again, these colleagues are from Ireland and they did a qualitative study and they brought together some people that do this work, PPI work. And yeah, that's what everybody said overwhelmingly is like, this takes time. And that is absolutely true. Okay, so here is where most of us, I think, have been trained, myself included. It's more of an extraction or taking approach to research, right? So we go in and we present it to academic audiences, and frankly, that's how we're rewarded, right? With degrees, jobs, tenure, and funding. And that's what we're trying to like unlearn, all of us, myself included. So this extraction approach to research, when you think about it that way, really we see that the change then has to start with us. So this is not about training people to work with us. It's about training us to work with them. So change starts with us. Again, avoid convenience partnerships. And the idea is to seek to give more than you take. So there's different levels of engagement, and to be very honest, throughout the phase of a research project, your leveling of engagement here is going to change, or at least it does for me. So I try to get to the allyship. So the idea is you move from, where you just want the community to cooperate with you because it's about your goals, to really not even about our goals. It's then allyship. It's about your goals, and I just journey alongside you with the ultimate goal being equity and inclusion. So the idea again is moving from just the community as consultants or your patients as consultants to that you're really working together. And again, sometimes, to be very honest, even though I'm aiming for allyship, sometimes when we're in a time crunch, I just want the community to cooperate with me, right? But it's helpful to think about this on a curve and sort of what our main aim is to be, and to move from just consulting to where they're really our partners. Okay, so Priscilla mentioned we have this resource guide on Unity Health Toronto. So how this came about was, I think it was 2019, there was a survey done of all the scientists at Unity Health, and it turned out like 90% of us do work with patients and the community. But at the same time, people were saying, you know what, for ourselves and for new people on our team, we really need some better resources. And so they brought together a bunch of folks, myself included, and we kind of brainstormed around what resources would be good. And then the focus was on resources that talk more about equity and inclusion as well. And so that's where you can find this. It was really, I think it just a couple of months ago came on our website. But today I'm going to take you through the level 1, the learn, and specifically on step 9. So what happens is you'll click on one of these levels. So we click on level 1, and then you see there's 10 things that you can click on, again with a drop-down menu. I'm not going to go through read all of these, but I highlighted just some stuff that might interest you. So like there's frameworks and best practices and the role of power. And really, I'm really obsessed with power and self-location, but I think this is really important. Again, change starts with us. So let's click on number 9, and then you get to this. And all of the drop downs look like this. There's a couple of great resources. I'm going to pull from each of them, but this one that I have the arrow by is great. This was developed in Kelowna with folks experiencing homelessness and academic researchers, and it's a really great resource. So, ouch. Here's what they say from that, the one in Kelowna. Your first contact with the community should not be to ask for their help. And I'm guilty of this too, right? So when I'm asking Covenant House for help, it's okay because I work there, but I do go outside of Covenant House and do work with other community partners. And sometimes that's true, right? That's our first contact with the community. I have the volunteers needed sign there, the graphic, because I want to say two things. One is, yes, we put up these posters, come and work with us, and that's our first contact with the community. But on the flip side, what I do on our team is if somebody does not have experience working in the area of youth homelessness or really don't know the community partners, I will suggest that they volunteer with our community partners. I just think that's a nice gesture on our end, and it really helps people understand the issue a bit better. So that's one of the things I try to do on our team. So Community-Based Research Canada has these 4 phases. I think this is super helpful of the research process. And you can see there you go from laying the foundation to the planning. And you can see there's this iterative phase where you plan, and then you gather the data, you analyze the data, and then you plan again. And depending on your study design, you may then change your study midway through, or maybe this is for the next study, but that's an iterative process. And then you act on the findings. So a couple things I want to highlight. You can see here that I put the red arrows because there's a relational aspect. So this is very relational work, relational aspect all the way through. The other word I highlighted or underlined in green there is negotiating. So absolutely every single phase, you're negotiating with your patients or your partners all the way through. And that's certainly been true in our work as well. So this notion of relationships and relationship building is something that I've been thinking a lot of, and the idea of outsourcing relationships. And so what I mean by that is, as the way that, I talked about this at the beginning, the way that we get rewarded typically in academia is that we apply for a grant, we get the grant, we hire somebody to run the project, and then we apply for the next grant and work on our publication, right? But then if somebody else is meeting with the community partners and developing these relationships, then this is a question I ask myself, then am I just a grant writer about community-based research? Like, am I actually doing it? Because to actually do it means to go for lunch with folks or to go for coffee with them and actually build a relationship. And so just a caution around outsourcing, because I think that gets us away from what it is we're trying to do with relationships. And again, I'm going to keep saying this again and again, this does take time, but so important and fundamental. Okay, so power. So here's us, right? Like reaching out to the community. Hey, I want to work with you. And sometimes the community is like, whoa. So how can we sort of be a little bit, cognizant of the power that we do have as researchers? So this is actually, these are some points. So I teach a graduate level course in critical qualitative research at Dalla Lana, and we talk about reflexivity, right? So the idea that as qualitative researchers, all the data flows through us. We're the research instrument. And so these are questions I get students to ask themselves about, why do I want to do this work? What are my core values, my assumptions? But I think that this is a really important thing for all of us to do and to get new members of the team to do before we look at engaging with community. And the last one is really important, and I'll build on it in the next slide, but not how might my identities impact this work, but how will my identities impact this work. So SPORE has this great wheel that I think is good to do on your own, and then as a point of discussion for a team. So you can see there's 3 circles. So the outer circle is areas for you to think about where maybe you have faced discrimination in your life. And then the purple part is to think about ways that you have power or you don't have power. And then the final one is areas in your life where you're advantaged and where you're disadvantaged. So you're both, right? Usually. So this is a great thing for you to do individually. And then what I think would be good is to come together as a team and then discuss that. And then ask the big question, what perspectives are missing on our team? This year, I've tried to make a more concerted effort into doing a better job of looking for what perspectives are missing on our team. And I can say that that's a more fun way to do research. And I'm hoping that my findings are more relevant by bringing in those missing perspectives for sure. So this is from, so you know the slide I showed you with our colleagues from Ireland with had the elephant in the room. So this is the qualitative study that they did and with people that engage in this type of work. And these are some of the themes. I'm not going to read them all out. You can see them on the slide, but they broke it down into worries, concerns, and barriers that people have when they want to do this work. But then what they also did, and I think that this is super helpful, is they developed this worksheet that I think would be great to do with your teams, a good starting place to actually, think about that diagram about where it starts with laying the foundation, the 4 phases. So this is an important foundational work. So like, let's talk about the barriers. Like, let's just be real about it. So I'll give you an example. So I'm right now just submitted an ethics application for a pilot randomized clinical control trial, and with 40 young people, 4 community partners, 3 cities. So I submitted that. And yesterday I'm in clinic all day. In the evening, I get an email from the ethics coordinator saying, I have 13 questions I want you to answer by tomorrow morning. Like, oh my goodness. And it's related to doing community-based work because, there's a lot of ethical things that go on, and especially when you're working with youth that are experiencing homelessness. So this does take more time. Thankfully, I was able to get it done, but I was like, oh man, I don't have time for this. But that's the reality. So worries, like, let's talk about worries on our team. So for example, a lot of people, this came up in that research paper that I was talking about, inadequate communication skills or underdeveloped communication skills. And then the last one is, let's actually talk, let's be real about what you think this is going to do to our research objectives, because that came up too. There's this worry that, oh, if I get the community or patients too involved, it's going to dilute my objectives. So let's just lay all that on the table, have a conversation, and then think about how you're going to address it. But then also think about the potential benefits, like what value will bringing folks from the community or our patients into this work in a more meaningful way. How will that benefit my research or our research? And then what impact might that have beyond my research or our research? And then time, you can see time has its own box. So like, right, how are you going to address it's going to take more time. And of course, more time sometimes means more money, right? So just to lay the foundation with that work. So just some key takeaways. This work is relational. The idea is to give more than we take. Change starts with us. It's not necessarily about training people to work with us. It's about training ourselves to work with them. And it takes time. And before we get to hopefully some great discussion, I just want to show you a picture of a project that we're working on now. So this was taken in August. And so we are co-designing a leadership manual with young people who have experienced homelessness. So that's all the young people here. And so we had a full day workshop with them. And so just a few things about this. One, we purposely did it in a location that has nothing to do with homelessness. So we did it out in the community. Also, you can see the person on the floor there that's making a V and the person to my right, they are new team members. So what I talked about trying to make more of a concerted effort into bring more diverse opinions onto our team. And one of the things that we did at Unity Health Toronto was there was a report that came out on the experiences of Black staff at Unity Health, and perhaps not surprisingly to many on the call, many of their experiences weren't great. And then they had some ideas for call to action, and I thought, okay, what can I do on my team? Or our team. I try not to say my team, our team. And so I made a commitment that 50% of our research staff will either be Black or Indigenous. So I've made a real, so that also meant some people needed to leave from our team to make space for others. It's been such a wonderful experience. And as you can see, the young people that I work with are disproportionately racialized young people. So it only makes sense, right? And I can tell you that Marty and Pookie, those are the 2 people on our team, the young people just love them. And, between the break, they were like, tell us your story. And Marty actually used to be homeless, so she's got lived expertise in homelessness, and Pookie's family, and Pookie as a child immigrated from Nigeria, and many of the young people here immigrated as well. And so it's just all that to say, like, they didn't want to leave at the end. And I'm just so happy with how it worked out. And ultimately, I think it's going to lead to more valuable findings for the community. And then the last thing, we talked about this work being relational over the long term. So that girl with the pink hair and the sun on her lap, I have known her since my doctoral work. So that was in 2015 when I met her when I was doing an ethnographic study. So, we've been in a relationship now for 7 years, and I keep inviting her to do stuff with us. Again, I don't do this perfectly for sure, but that's just an example. So maybe I will end there, and I'm hoping we can have some discussion. I'd love to learn from you and hear what you have to say. So, that's my email address. Reach out anytime. I'd love to chat.
Thank you so much, Naomi. I can't tell you how I've been waiting 2 weeks to see this presentation and to have this conversation with you. It was well worth the wait, and to hear about your experiences with community engagement, as well as to share that photo at the end. I think that was so impactful to see the team as well that are involved in the great work that you do here. So thank you very much for today's presentation. I am going to stop the recording at this time.